Dr. Frank Rosenblum is a family doctor.
And your cholesterol is fantastic.
But that's not the diagnosis this Oregon physician sees for the country's healthcare system.
Healthcare costs too much, not because of the innate requirement of the cost of healthcare, but because of those things added on top of healthcare that become such a burden to the system that money is spent because of that burden.
One enormous burden is the growing practice of defensive medicine. Doctors ordering expensive and sometimes unnecessary tests because of the fear of malpractice lawsuits if they don't. Doctors say they would stop this waste of time and money if the government would limit the money patients can receive when they sue their doctor. President Obama told the American Medical Association no.
I want to be honest with you. I'm not advocating caps on malpractice awards, which I personally believe can be unfair to people who've been wrongfully harmed.
What the president is advocating includes his plan for a government-run insurance option.
That doesn't mean we oppose. It means we would like to talk about perhaps other options.
Many doctors believe a government option will turn into a government takeover. Doctors say not-for-profit government insurance will be priced so low that employers faced with a situation where it's much cheaper to insure their employees with a government-run plan will transfer them from private insurance to government insurance. Doctors fear that move would result in a situation like Medicare, the current government plan for seniors, which pays 20% less than private insurers.
Medicare reimbursement is now so low, any physician will tell you that seeing a Medicare patient, if you count the overhead in terms of seeing the patient, will cost a physician between $5 and $10.
That leads to concerns of decreased quality because the government, not patients or doctors, would be calling the shots. The flood of newly insured patients could also mean longer waits at the doctor's office.
The bottom line is when you have people who are responsible for very little of their own health care, their own medical costs, they tend to overutilize medical care. And this is what we're seeing with the entitlement mentality.
There are 900,000 physicians from coast to coast, so it only stands to reason that within that number there are differing opinions about the best prescription for America's ailing healthcare system.
All right, say cool, okay. Good job.
Baltimore pediatrician Margaret Flowers favors a single-payer healthcare system run by the government and cutting out competition among private companies.
We know that the administrative overhead of Medicare is about 3%, compared to an administrative overhead in private insurers of about 20 to 30%. So it's a really big difference, and that means that we're wasting about a third of our healthcare dollars on administration and paperwork, those dollars that could actually be used for health care.
She says government-run health care will give control to doctors and patients and take it away from private insurers.
And then if we look at why insurance companies make these decisions, that's the biggest problem, is that they make those decisions not based on what's best for the patient. It's based on what's best for their profit and the interests of their investors. And we just think that there's something morally wrong with that.
So although there's some disagreement among the nation's physicians about the best cure for America's health care, most agree their focus should be medicine, not business or politics. Lori Johnson, CBN News.